Dr. Ario here. Welcome to another session of Health Talk. So today we are dealing with cancer, particularly cancer risk. We are going to be looking at some of the things that are known to increase a person's chances of getting cancer. But before we do that, why is it important that we actually address cancer? Because cancer is a disease that is killing millions of people. In fact, it is among the 10 leading causes of death worldwide, with about 17 million new cases of cancer diagnosis being reported each year. So it is quite a serious problem. You may know someone that has been affected by cancer. You might even be the one that has been affected by cancer personally. So you see, it's something that we cannot ignore. Personally, in the last 2 months, I have known 4 people, quite young, fairly young people, that have actually died because of cancer. So I think every one of us knows someone or have been around someone that has been affected by cancer. So when it comes to our health and living healthier, it is important that we are aware of this condition and see what we can do to hopefully prevent our risk of cancer. So let's move on. Can we stop everyone from getting cancer? Maybe not. But the good news is that actually 30 to 50% of cancers are preventable. And I think that is fantastic news, but also it is significant for you to know that 30 to 50% of cancer cases are actually preventable. So something could have been done to prevent it. Okay? We know for a fact that certain exposure to certain risk, exposure to certain risk can increase a person's chance of developing cancer in their lifetime. So I think, it is worth knowing those risks so that we can try and avoid them. Okay? Now, what is cancer? You've heard of people die of cancer, people having to go through treatment because of cancer. You may even have experienced a negative effect of what cancer can do. But what is the disease itself? Do we get cancer because, someone put something foreign into our body? What is happening? Okay? Essentially, cancer occurs as a result of some form of insult or what we call injury to normal cells that causes damage, and change in the cells at their genetic level, that then causes what used to be previously normal cells to begin to change in terms of how they function. So they begin to change and act in a very uncontrolled way. Now, if you remember your science lessons, from very early on when you were in school, you remember that the body is made up of many cells. I mean, you can say billions or trillions, or how many number of cells is uncountable, really. So the body is made of loads of cells, and normally our cells go through a process of cell division. They'll make more of themselves to be able to perform a certain function through a process called cell division, and then also obviously maintain the turnover, the amount of cells, through cell death. So usually when new cells have performed their functions, after a period of time, cells will die, new cells will be formed, and that goes on. But that happens, in a very controlled, in a very regulated, coordinated manner, And the body is able to do that because of our DNA, because of our genes, which is sort of our information center that makes sure that everything is happening in the body the way it should be. Now, what happens in cancer due to some form of damage, either external factors that have been introduced into the body causing damage, or actually the body itself making some mistakes of its own, it can cause this natural process to become then very uncontrolled, And therefore, what would then happen, instead of cells, when they divide normally, they would obviously divide to make a certain amount of cells, which is needed for a particular function. In cancer cells, what then happens, if normally you make 10 cells, in cancer cells, you end up making 100 cells. and actually you don't need 100 cells, okay? But also the problem is when cells are supposed to die off, so cells that are not needed that the body needs to get rid of, this doesn't happen. So you end up with a lot of abnormal cells in the body. And the funny thing is that this is very uncontrolled, this is very unregulated, so you end up with so many abnormal cells, okay, which can then spread quite rapidly, yeah, and cause problems. Now usually cancer cells actually can influence normal cells, okay, to encourage spread. So for example, cancer cells would sort of encourage normal cells to supply it with a blood supply. Now remember, in our body, blood needs to flow because we carry nutrients around, which is important for all the cells to perform their normal function. So when a cancer cell obviously has access to blood flow, that means that they're going to get nutrients, okay, that they need to be able to even spread and grow much faster, okay? And the danger of that as well is that they can spread to other parts of the body. And this is why, if you say, for example, you know, is there any one particular cancer? As you probably know, there isn't. There's so many different types of cancers. That's because cancer cells can occur and can happen in any part of the body. So that's why it's possible for someone to have lung cancer, someone to have brain cancer, someone to have breast cancer, any part of the body, this process can happen, okay? And also the problem with that is that because cancer cells can spread so rapidly, it is possible for someone to have maybe lung cancer, and then if it's not picked up early, you know, they can end up with liver cancer because you've had spread of cells to that area, yeah, through the bloodstream, okay? So I hope you just understand a bit more about what cancer is, okay? Now, let's talk about the things that evidence from studies over a period of time have shown that actually can increase one's risk of getting cancer. Now, I've sort of grouped it into what you would say modifiable risk and non-modifiable. So modifiable means that these are risks that you can do something about, that you sort of have some form of control over, and non-modifiable ones are the opposites, yeah? So you and I, you know, if this risk are present, we can't do much about it. So let's start with the ones that we can do much about it. The honest truth is that actually the ones that we can do much about it, there isn't a lot of it, okay? So the first one is age. Naturally, as we all age, you know, the body doesn't function as it used to. The body is likely to make some mistakes along the way, but also generally over time, your body is more likely to have been exposed to a lot of risk, okay, or some form of damage. So that's why age is always a big factor, especially when it comes to any illness, actually when it comes to any condition, okay? And age is one of those things. So usually from the age of 50, actually, your chances of cancer is significantly higher than someone who is younger. So, and this is actually seen in a lot of the common cancers. So it's like breast cancer, lung cancer, prostate cancer, bowel cancer, you know. Having said that, there are certain cancers that actually can occur in younger people, okay? So things like leukemia, so bone cancers tend to happen in younger groups. So cancer really is no respecter of person's age, okay? It can happen to anyone, but actually, as a rule, most cancers tend to be more common in the older population, okay? So age is the first risk that you need to know that you and I cannot help. You know, no matter how we do plastic surgery or try to change our appearance, you know, your body does not lie internally, okay, in terms of your age. The next thing is family history, or what we call genetics, okay? So, you know, we all, if you are part of a family, you have the genes of your family, okay? And therefore you cannot run away from it. So certain conditions are genetic. Certain cancers are actually genetic. They run in families. So we know, for example, breast cancer, a large proportion or a group of people, actually there's a risk. There's a particular gene that increases your risk of getting breast cancer. So if a family has that gene, then often they are more likely to be affected, or their risk for getting breast cancer is therefore higher, pardon me, or increased, okay? So that's one thing to know about genes, okay, can influence. But the honest truth is that thankfully, you know, in terms of when you look at generally cancers, genes playing a part actually is not much. It's about 3 to 10%, you know, if you look at the bigger scheme of things. So it's not much at all. And that goes to show that actually the body doesn't get it wrong most of the time, because really your body is such a complex but also very unique and very clever thing. And the way nature has done it is that, you know, your genes, they don't make mistakes by themselves most of the time. You know, they rarely make mistakes, okay? And one thing to bear in mind is that, you know, if there is a particular gene that, you know, puts you at risk of cancer in your family, this tends to present quite earlier on. Okay, so for example, I mean, we will say most people's risk of breast cancer, most women's risk of breast cancer, I will use that as an example, is usually higher from age 50, even age 60. Okay, however, for someone that has a risk, genetic risk, they probably would end up, you know, possibly getting, it's possible for them to get breast cancer at age 40 or even less. And therefore, those people often need to be screened earlier, okay? So for example, in the UK, breast screening is offered from age 50, all right? But obviously, if someone has a genetic gene that predisposes them to getting breast cancer, you know, we will not be waiting for them to reach age 50 before we screen them. So these kind of people, there is what we call the family history breast clinics, okay, which is in the UK. And likely there's equivalent of such clinics in other countries as well. So it's important that you have that discussions with your doctor if you feel that there is a strong family history of breast cancer. And when we talk about family history, we're talking about, you know, your mom, your dad, your sisters, you know, your brothers, and then working it outward basically, okay? Obviously the risk gets less and less as you go further down the family tree, but it's usually your immediate family as the starting point. So as you can see, overall, the sort of risk factors or the risk that you can't do anything about is not a lot. You know, age and family history or genetics, we can't do much about it. But that's all actually when it comes to the risk factors, the known cancer risk factors that you can't do much about. So now let's look at the ones that are possibly preventable. So the cancer risks that are possibly preventable. The first one at the top is tobacco smoke, okay? So it's the leading cause of cancer and cancer death when it comes to, you know, across board, okay? It's the leading cause of cancer and cancer death, smoking, yeah, tobacco smoking. And you know, you might say, you know, well, I don't smoke, so I'm safe. But actually, if you're a passive smoker, i.e. if you're always in an environment where other people are smoking, whether you live with relatives that smoke or you work in an environment where people are smoking, then you are a passive smoker. And actually, your risk, you also have a risk of getting things like lung cancer even though you don't smoke yourself. And actually, I have come across people where they've never smoked themselves and they've ended up with breast cancer, with lung cancer. So it is possible. But usually, I think most of us identify with lung cancer as, you know, because of smoking. But actually, tobacco smoke can cause a lot of other cancers. So we're talking about the lungs, we're talking about your larynx, which is your voice box. We're talking about your mouth. You can get cancers in the mouth because of smoking. You can get cancers of your gullet because of smoking, cancers of your throat, of your bladder, of your kidney, of your liver, of your stomach, of your cervix as a result of smoking. So, you know, there's so many other cancers that actually smoking can be a culprit for. People who use like all those smokeless tobaccos, you know, the ones that they do the chewing, or for example they chew the tobacco or they snuff the tobacco, actually are at increased risk of things like cancer of the mouth, okay, cancer of your gullet, okay. So that's something for you to be aware of, because I know in certain environments, certain communities or certain countries, you know, the old men, they'll be sitting down, they'll be chewing the tobacco actually, you know, even the teeth and everything will change color, they'll still be chewing it, okay? and there is a risk of cancer associated with that. Now, you might be asking that, is it, how many cigarettes you smoke or how many tobacco you smoke, is it relevant whether you get cancer or not? Actually, there's no safe level of tobacco use, okay? So whether you smoke 2 or whether you smoke 10, 50, okay, your risk is high as long as there's a long-term exposure to that. So when we talk about risk, it's just not the one-off exposure of that risk, but it's actually the continuous, the consistency, and the prolonged exposure to that risk then increases your chances of getting cancer. So if you've been smoking 10 cigarettes for 50 years, and someone has been smoking 20 for 50 years, you've all been smoking and been smoking for that many years, so your risk of cancer is still the same, okay? And actually, another question that often people say is that, is there any point in quitting? I've smoked 50 years of my life, if I stop now, is there any point in quitting? Definitely yes, there is a point in quitting, because the evidence out there and all the studies that have been done actually suggest that if you stop now, you significantly improve your life expectancy, okay? So if you were to stop smoking now, actually people that have stopped smoking for 10 years, okay, it almost become as if they've never smoked, okay? So there's always time to make a change. So if you have decided that you want to quit smoking, I know it can be difficult, because actually habits are easy to form, but habits to break is always a difficulty, yeah? And that goes across board to anything in life. But if you are determined to give up, then please, seek help, speak to your doctor. I know in most pharmacies, actually they offer the service to help you quit smoking. You can speak to your nurse to get support, because often, getting that extra support, help. Get your family involved to encourage you to stop smoking if you need the extra help, okay? And then do it, and then actually you will see a lot of difference, okay? The other thing as well that often, people might ask, okay, for example, I remember when I used to work in palliative care, and, obviously you're dealing with patients that have already, been diagnosed with cancer, and some of them were still smoking, and, the argument would be, I've already got the cancer, so is there any point to me giving up now? Yes, there is still a point in giving up, because actually, even if you've been diagnosed with cancer, because often when you're diagnosed with cancer, there is you're given how much you're going to live after the diagnosis, sometimes in situations where this can be given. And actually there is evidence to suggest that if you even stop smoking, you reduce your risk of dying from that cancer. So in a way, you're going to prolong your life a bit better. And for you, if obviously you have loved ones and life is actually important to you, and there's still something that you need to do, then actually quitting at that time is not a bad thing, okay? So you can still give up. So overall, yes, you can give up anytime. The next risk, okay, that we can all do something about is obesity. Being overweight, the studies have shown that actually increases your risk of getting cancer. Example, cancers of the breast, especially in women who have gone through the menopause, cancer of the colon, which we're talking about your bowel, cancer that affect the lining of the womb, cancer that affects your esophagus, your gullet, your kidney. So being overweight, actually, there is an increased risk. And hey, we can all do something about our weight. You can do it through healthy lifestyle choices, through your diet, through physical activity. You can seek help with your doctor to put you up on weight management programs if you need to get that extra support. Now there are some medications that can be given to help assist the process, to help you lose weight. So there's always a way out. So there's no excuse why you cannot do that. Some people, if they meet the criteria, can have gastric bypass, they can have an operation just to help them to lose that weight that they need to lose. And also remember, I did a session on obesity, being overweight, and the risk associated with that. So you can find this also on this Facebook page, also on the YouTube channel, Dr. Aria. So please, make it a point to have a listen, and you gain a lot from that. And conversely, we know that obesity obviously increases your risk. Conversely, if you actually, reduce your weight or maintain a healthy weight, eat the right food, keep physically active, you actually reduce your risk of certain cancers. Okay, so overall, this is something to go for. The other thing that has been linked to cancers or your risk of getting cancer is diet. And when we're talking about diet, we're talking mainly about a diet that is low in fiber. I know most of us don't like our fibers, we don't like our vegetables, we don't like our greens and fruits, but actually it's a very good source in terms of when it comes to your diet, because vegetables, fruit, they are very good and very rich in certain antioxidants, which are important for the body to fight infections and to fight illnesses. So it's important. Also, a diet that is too much high or too high in red meat can increase your risk of cancers. Some people we can't do with their meat. They have to have about 2 or 3 portions of meat on their, so please, if you are that kind of person, then you need to think about cutting down. Also, a diet, so you want to aim for a diet that is rich in fruits, a diet that is rich in vegetables, because that actually acts as a protective mechanism to fight against cancers, and that has been shown through studies by nutritionists. So please do pay attention. You want to make sure that your diet is rich in certain minerals like folate, so things like folic acid, vitamin D has been shown to some extent, and antioxidants. Okay, so things that are rich in in those sort of minerals, you need to try as much as possible to incorporate them in your diet. The other thing that can increase your risk of cancer is what we call carcinogenic or cancer-causing agents. So we're talking about things like asbestos, which often people that work in certain environment, if you live in certain houses, that there might be a risk. So much nowadays there's not much of that because there's a lot of regulation that makes sure the houses are safe for people to live in. But people that have been maybe previously due to their job, maybe in the mining industry, they used to work on the docks, they may have been exposed over a long period of time to asbestos, and therefore their risk, later on of getting certain cancers can be increased. If you have chronic exposure to certain gases like radon, can cause that. So I think, especially for people that maybe work in certain industries where you have to work with chemicals, you have to work with certain things, it's usually important that you are safe. Make sure you wear the protective clothing that your work provides, and also make sure that obviously you don't put yourself at risk as much as possible. And if there's any exposure, then you already seek help when you need it. Okay. The other thing that can cause or increase someone's risk is what we call immunosuppression. Like, normally our body's immune cells helps us to fight against, it's like our defense mechanism. It helps us to fight against diseases. It deals with all damaged cells in the body, so we don't have to even worry about it. But often people might have conditions that dampens down the immune system and makes it difficult for them to fight against things like cancers and other illnesses. So it is important to get vaccinated if you need to, for example, for those hepatitis infections. Also, don't share needles, and like I mentioned earlier, make sure you avoid unprotected sexual intercourse. Okay. The other thing that is also a common risk is radiation. Okay, exposure to radiation, which can happen in different ways. Sometimes people through where they work, or we're talking about really like things like gamma radiation. So it depends on the job you do. If you're exposed to certain X-rays, or you've had too many X-rays over a period of time, too much exposure. Even sometimes people get that exposure through maybe being investigated for other things, but that's something for you to be aware of. Okay. And then the final thing that is a risk that in a way can be prevented is sunlight exposure. Too much exposure to sunlight. you know, the sun is a wonderful thing, you know, it brightens our day, but in terms of it's quite the radiation that is sent off, it gives off ultraviolet, which is a form of radiation, and too much exposure to that can actually cause early aging of your skin, okay, and cause skin damage. So often people that like their suntan, going into the sun, make sure that you apply your sunscreen, make sure you wear your sunglasses, and sunscreen is important that you actually apply it on about 15 minutes before you go into the sun, not when you're sitting in the sun and then you put it on, okay? And also make sure you have your hat on. Often I see a lot of bald people, you know, with their scalp, you know, bare, shining in the sun, and actually they're causing more damage to their scalp. So make sure that you wear a cap or a hat if you need to. Make sure you don't stay too long in the sun. Okay, so usually between mid-morning and late afternoon is actually when there's too much sun, okay, and that's when you don't actually want to expose yourself to that. So you need to limit the amount of time that you are in the sun during that period. And yeah, so I'm going to stop here, but I hope that has helped. So as you can see, actually the things that we can do something about in terms of the risk is much more than the ones that we can do much about. So as much as it is within your power, try and avoid some of this risk, okay? Because cancer is real, cancer is deadly, and it's killing people. So our next topic on the cancer series, we will be looking at the red flags, yes, that you should be looking out for, the signs and symptoms that you should be looking out for when it comes to cancer. So don't miss that. You've been listening to Dr. Ariel dealing with cancer risk. See you next time. By the way, if you're watching from YouTube, don't forget to press on that red button to subscribe, okay, so that you can watch all those amazing videos and get a lot of knowledge about your health. Remember, health is wealth, okay? And if you're watching from Facebook, don't forget to like, comment, and please share the videos with other people so people can benefit from it. So until next time, see you. Bye.